question that everybody asks is, am I going to have a corneal transplant eventually, or maybe not?
Okay. Yeah, so, yeah, and I think because there's a shift in the management of keratoconus the past few years, and there's been some confusion here. So in the past, before we had cross-linking, if a patient started to progress and we see that they are progressing, we will often tell them eventually you will need a corneal transplant, because rings didn't stop progression, spherical contact lens did not stop progression. The only thing that stopped progression, twofold, is cross-linking and stop rubbing your eyes or sleeping on your eyes. Those are the two components that actually stop the progression of keratoconus. So the shift has now moved towards doing cross-linking early, but we still do corneal transplants in some patients. So let's say we see you and the keratoconus are really advanced. We talk about grade 4. The cornea is very thin. It has already scarred. Often we talk about hydrops. So the cornea was bulging so much that a small rip formed or tear formed in the inner layer of the cornea, and then you get swelling and scar formation, or it's so steep that you can't even fit a normal scale contact lens. And we also see that there's no tissue to resurface or to ablate. Like a ring is not going to do much. In those patients, we have to do a corneal transplant. And it's not always that we have to do a full thickness transplant. I think as long as there's no scar or that inner layer hasn't torn or ripped, we can actually do a partial transplant. And with the partial corneal transplants, we found that it lasts much longer. Your risks are much lower for rejection. And once we've done the corneal transplant, uh, and you've gone through your whole year of suture removal, because the sutures need to stay in the cornea for a year, one can start with the visual rehabilitation, where we do a bit of resurfacing. We might do implantable contact lens or a lens replacement. So also, just remember that when we do a corneal transplant, it is not a one-stop solution and your problems are sorted. It is just, we're just giving you tissue to work with. We still have to do work after that to give you decent vision with glasses.